Have you ever noticed a strange smell and didn't know where it came from? It might seem like something simple, but the truth is that some body odors can be silent signs of cancer, signs that almost no one notices. In today's video, we will reveal 8 smells that could indicate cancer and could save your life or the life of someone you love if detected in time. Some of these signs go unnoticed for months or even years because they seem common or harmless. But ignoring them can be extremely dangerous. Stay with us until the end, because each smell we show could be an early warning that greatly increases the chances of recovery. Pay attention, observe your body, and if necessary, share this video. It could truly save lives. If you find this video useful, comment 1. If you don't like it, comment 0. This helps me improve and bring even more relevant content. Have you ever noticed a strange smell and couldn't explain it? What if I told you that some body odors can be silent signs of cancer? The first sign is a smell that resembles mold, damp wood, or something that's been stored for a long time. This odor may indicate mouth or throat cancer. It appears because the tumor can cause tissue necrosis and release volatile chemical compounds that produce this characteristic smell. Often, people who notice the odor think it's just poor oral hygiene or dental problems, delaying the search for medical help. Besides the smell, other signs may appear, such as persistent hoarseness, sores that do not heal, white or red patches, and pain in the throat or ears. If any of these signs are present, it is essential to see an ENT specialist or oncologist. Tests like biopsies, CT scans, or MRIs can help identify the problem and allow for prompt treatment. The earlier cancer is detected, the higher the chances of recovery. Ignoring these signs can be costly. Another smell to watch for is a strong, persistent decomposition odor in the stool, which may indicate colorectal cancer. Many people ignore this sign because they associate changes in stool odor only with diet or common digestive issues. Colorectal cancer alters the digestive process, releasing toxins and gases that completely change the natural smell of stool. It is a warning the body gives even before more serious symptoms appear. In addition to the odor, pay attention to signs such as blood in the stool, persistent abdominal pain, changes in bowel habits, or unexplained weight loss. When these signs appear together, medical attention is urgent. Tests like colonoscopy, stool analysis, or imaging can identify problems at an early stage, greatly increasing the chances of successful treatment. A sweet and unpleasant odor from the skin or wounds in the breast may be a silent sign of breast cancer. This odor appears mainly in more advanced cases, when there is infection or tissue necrosis in the affected area. Tumor cells, as they grow uncontrollably, can cause local inflammation and release chemical compounds that produce this characteristic smell. Open wounds or ulcers in the breast are often the source of the odor, which can be mistaken for a common infection or poor hygiene, delaying medical attention. Besides the smell, watch for lumps in the breast or armpits, changes in skin texture or color, abnormal discharge, and persistent pain in the area. Any combination of these signs, especially accompanied by a sweet and unpleasant odor, requires immediate medical attention. Breast cancer has high cure rates when detected early. Paying attention to the characteristic smell can truly save lives. A smell of sulfur or rotten eggs on the breath may indicate stomach cancer. It arises when the stomach cannot properly process food, releasing sulfurous gases in the digestive tract. Many people confuse it with reflux, gastritis, or minor digestive issues, but the persistence of the smell should be a serious warning. Other signs to watch for include abdominal pain, early satiety, loss of appetite, unexplained weight loss, and frequent nausea. If you notice this persistent breath odor or other digestive signs, see a gastroenterologist immediately. Early diagnosis greatly increases the chances of effective treatment and recovery. A smell of rotting meat or something decomposing on the skin may indicate skin cancer, especially melanoma. It occurs when cancer cells begin to necrotize, releasing volatile chemical compounds. The odor may appear in open wounds or lesions that do not heal, often in hard-to-see areas like the back or scalp. Many people confuse the odor with minor injuries, common infections, or hygiene issues. If you notice a persistent smell coming from a skin wound, see a dermatologist, even if the odor seems small or insignificant. Observing unusual wounds and odors can be the difference between early diagnosis and advanced disease. A strong and pungent ammonia odor in the urine may be a sign of kidney cancer. The tumor can affect kidney function, which filters the blood and removes toxins. When they do not work properly, there is an accumulation of chemical byproducts, like urea, which produces this characteristic smell. Not all ammonia odors indicate cancer, but if it is persistent and unexplained, it deserves attention. Other signs may include back pain, blood in the urine, extreme fatigue, and unexplained weight loss. Kidney cancer is more treatable when detected early. Observing changes in urine odor can save lives. A metallic smell, similar to rusted iron or old coins, may be a warning sign for blood cancer, such as leukemia or lymphoma. It appears because cancer cells alter levels of iron and other chemical compounds in the blood, noticeable in breath or sweat, especially after light physical activity. This sign is easily ignored. But when it appears along with extreme fatigue, persistent fever, recurring infections, and unexplained weight loss, seeking medical help is urgent. Observing subtle signs like this can make all the difference in early diagnosis and recovery chances. Finally, a sweet and slightly fruity odor on the breath may indicate lung cancer. It is caused by the release of volatile organic compounds by cancer cells. Although it resembles fermented fruit, it does not go away with oral hygiene and tends to be persistent. This sign can go unnoticed for months, as many people confuse it with digestive problems or diabetes. If the odor is frequent and unexplained, see a pulmonologist. Lung cancer is silent and dangerous, but detecting early signs can save lives. If you found this information useful, leave a like, share this video, and subscribe to the channel. Sharing these signs could really save someone's life. Stay alert, stay healthy, and see you in the next video.